Got a very common AMC style pediatric abdominal question here. So before we get into it, read the question and then I'll go through some important points and go through the answer options. So you can see that this child was born for fetal distress. Birth weight was 3,550 grams, which is normal. Normal birth weight is around 2.5 kilos to 4 kilos. Initially fed well, but is now vomiting after every feed. At 20 hours, she brought up everything. She's afebrile alert and eager to feed. Abdomen soft, non-distended, and she has not yet passed meconium. And then we got this picture here. So this is a pretty common picture you'll see. This is some of the vomit she has vomited up, and you can see it's in all the linen. So this is green or bilious vomiting. Important to know. So let's go through the answer options. So E, pyloric stenosis. This is incorrect. Pyloric stenosis typically presents with a postprandial projectile non-bilious vomiting, also presents with an olive-like mass upon palpation in the epigastric region. It typically presents within the first 3 to 6 weeks of life, not within 20 hours. Common metabolic disturbance you can get, which is another common question. From all the vomiting and the loss of the hydrochloric acid, you get a hypokalemic metabolic acidosis. The way to diagnose pyloric stenosis is ultrasound, where you see a lengthened and thickened pylorus, and then the treatment is a pyloromyotomy, which is where you surgically incise the pylorus. D, neonatal sepsis. This is incorrect. She's afebrile alert and eager to feed. You wouldn't see all these things if she was septic. C, meconium ileus. This is incorrect. Although she hasn't yet passed meconium, she's only at 20 hours of age. It's common to pass meconium within 24 hours, even up to 48 hours. So we can't yet rule that out. But she would also potentially have a distended abdomen. Same with Hirschsprung's disease. You would have distended abdomen. With Hirschsprung's, you can also get an associated colitis, where you get inflammation of the bowel, where you would get distension and you would have more hemodynamic instability. So the correct answer is A, which is duodenal atresia. Remember, this is failure of recanalization. You get the double bubble sign on X-ray, where you get a distended stomach and a distended duodenum. Remembering that the most commonest thing to see is bilious vomiting, because remember where the common bile duct enters into the duodenum at the ampulla of Vata. You will see that, as opposed to pyloric stenosis, where the obstruction is at the pylorus, so you wouldn't see any bile. And it typically can present within the first 24 to 48 hours of life. So other kind of important abdominal diagnosis to make in pediatrics, we also have things like hernias, ovolvulus, necrotizing enterocolitis. You can also get intussusception. Remember, you see that red currant jelly stool and you get that kind of target lesion on an ultrasound. And yeah, those are probably the most important ones to consider. So thank you guys for listening. If you liked it, please comment, subscribe. Thank you.